What's up guys? In this video I'm going to go through how to deal with first aid emergencies involving bleeding and traumas. Just as a disclaimer, we are not responsible for any damages caused by use or neglect of use of this video. Alright, now that we got that out of the way, let's get on with the video. First let me tell you a common mistake people make when they see bleeding. People often overestimate the bleeding and overlook more serious problems. So, before you start caring for the bleeding, verify that there is nothing that requires more attention and after start controlling bleeding. To control smaller wounds such as a paper cut, just require thoroughly washing the wound with soap, applying an antiseptic and then attaching a band-aid to the affected area. To control slightly deeper wounds such as a knife laceration where extensive bleeding is lethal, use a dressing lightly soaked in an antiseptic and apply pressure to the wound using your gloved hand, then attach tape around the dressing to keep it stable. Then call emergency services to get the wound stitched in a hospital. To control heavier bleeding caused by extreme injuries caused by deep lacerations or open fractures, applying pressure with a dressing just won't be enough because the cut isn't just on the dermis but is damaging the main arteries/veins. This is when the tourniquet is required. It partially cuts off blood flow to that area to prevent further blood loss. However, tourniquets can be equally as dangerous as the cut itself if applied too tightly, as then it would completely cut off blood flow and cells would start to necrose from the lack of oxygen. Too little and it is useless, so the goal is to get the tightness just right. For punctures and impaled objects, they pose a serious risk to the victim as punctures often penetrate deep and damage internal organs or your body's main arteries or veins, which can additionally lead to internal bleeding. When treating an impaled object, the first rule is to never attempt to remove the object, as it is often the only barrier between a major blood vessel and the environment.
Blade is in your aorta. You pull it out, you will bleed and you will die.
Instead, stabilize the impaled object with gauze and dressings, then call emergency services immediately. Next is eye trauma. This can occur through direct blows, foreign bodies or scratching of the eye. Typical symptoms include redness of the eye, tears, and changing vision. For more serious injuries, bruising and bleeding may occur from lacerations. Simple irritants causing the milder symptoms such as dust or bugs can be flushed away using water. Chemical exposure should be thoroughly washed with water, then call emergency services if any of the symptoms don't improve. If a more serious injury occurs as previously described, protect both eyes with a bandage or eye shield. You may be asking why both eyes. The answer to this is firstly because both eyes may be damaged, but most importantly because eyes move in pairs. Hence, if you cover both eyes, the healthy eye is less likely to move, which makes the damaged eye less likely to move, therefore preventing worsening of the injury. When doing this, make sure to remain with the person as they could become frightened and may attempt to remove the bandage. And of course, if this happens, immediately call emergency services. Head injuries are next, and they could happen from any form of trauma to the cranium. Symptoms include confusion, headache, nausea and vomiting, memory loss, loss of balance and coordination, seizure, or loss of consciousness. Head injuries are riskier than most other traumas because it can often leave a person with mental challenges which affect the rest of their lives or outright kill them. So, protect the person through lying them down and stabilizing their head and neck manually. Call emergency services, and as you're waiting for them, be prepared to perform CPR if necessary. Link in description. Bone and joint injuries are commonplace to athletes but mostly occur in daily life situations, and so it is very important to know how to treat those injuries. First aid for both sprains and broken bones includes firstly making sure the scene is safe, then applying gauze to any open wounds, apply an ice pack to the injured area for around 20 minutes, then contact a healthcare provider and request medical evaluation. Call emergency services if any of the following are present: an open wound over a joint, abnormal position or bent extremity, or obvious joint dislocation. What can also be dangerous is an open or compound fracture, which occurs when the bone breaks through skin. In this case, do not attempt to push bone back in the body, but instead make a splint, or if you have one for the said body part, use it. A splint is something used to apply pressure on the two sides of your arm, leg, finger, etc. To stabilize it, it can be made using magazines and tape, for example, or 2 pieces of wood and tape. Finally, if you are ever unlucky enough to care for a person who just got amputated, do the following: first call emergency services, then rinse the amputated part with water, wrap the amputated part in gauze and place the part in a sterile plastic bag, then put that bag in another bag with a lot of ice to keep cool for potential reattachment at the hospital. Apply a tourniquet to the amputated person's stump as well as attaching gauze with a dressing to prevent lethal blood loss. Also write their name on the bag so the hospital knows whose limb that is. This video was mainly about teaching the basics of first aid. If you want to learn about how to respond to the specific scenarios you might encounter as a first aid respondent, check out our channel as we post videos every week about this and a lot more cool medicine related topics.